Learn about plastic surgery procedures for male and female genitalia. Most plastic or cosmetic surgery is apparent to the naked eye. Her breasts look bigger, or smaller or higher. His nose looks straighter. But some plastic surgery results are visible only to the recipient, and perhaps their significant other. Requests for plastic surgery on genitalia are on the rise, motivated by desires for an improved self-image or increased sexual satisfaction. And while most plastic surgery procedures are performed on women, about 80%, in fact, it turns out that more men than women request work on their private parts. This list reveals some of the procedures that are currently on the menu. Would you consider going under the knife down there? Number 10. Monsplasty. The mons pubis, or mons, is the triangular fatty pad covering the pubic bone, running from the top of the pubic hair down to the genitals. Both men and women have it, but it's more obvious in women. The surgery is more popular with women, but men can also receive the benefits. Fat accumulation and loose skin, from weight gain/loss, aging, C-section, hormones, and even genetics, can lead to enlarged mons. Monsplasty removes excess skin and fatty tissue to give the mons a firmer, flatter appearance. While many cosmetic procedures involve liposuction to remove fat, menoplasty is surgery that uses a scalpel to remove the offending skin and fat. The procedure often accompanies a tummy tuck because a bulging mons pubis is often more noticeable after removing fatty tissue and tightening the skin on your abdomen. While the procedure delivers aesthetic improvements, it has other benefits as well, making intercourse, urination, and even hygiene easier. Labiaplasty. A labiaplasty is a vaginal rejuvenation, or designer vagina, procedure. Vaginal rejuvenation often involves lasers, ultrasound, or other energy devices to tighten the vaginal area. But a labiaplasty is surgery that reduces the size/shape of a woman's genitalia. The labia can become enlarged due to childbirth, aging, sexual activity, or genetics. The condition, when revealed by form-fitting clothing, is sometimes referred to as camel toe or crotch cleavage. An enlarged labia can cause difficulties with exercise, sex, and hygiene and may lead to urinary tract infections. It can also interfere with wearing clothes like yoga pants and swimsuits. There are different ways to reduce the size of the labia, for example, trim procedure, wedge procedure. The overall goal is to remove the excess part of the labia minora, the inner tissues of the female genitalia, so it lines up with the labia majora, outer part.